Okay. Are you having a migraine attack? Time to be direct. Let's go. Debox and determine that everything is in good shape. It looks good to me. Next, you install. Just be careful. It can be a little sharp. Well, R is for ready. You ready the pod by priming it. You press firmly 4 times. This is very important. Looks like it's ready. Now you engage the pod to the nose and you press like you're priming. It's nice and gentle. Now complete your dose in the other nostril. Last step, T is for toss. Get rid of it, throw it away. You do not need it. You only use it once. That's it. You have a migraine attack? Be direct. And don't forget to check out these. Stay tuned for important safety information.
For complete administration information, please see the instructions for use sheet that comes in each box of Trudhesa. Indication and important safety information. Indication: Trudhesa is used to treat an active migraine headache with or without aura in adults. Do not use Trudhesa to prevent migraine when you have no symptoms. It is not known if Trudhesa is safe and effective in children. Important safety information. Serious or potentially life-threatening reductions in blood flow to the brain or extremities due to interactions between dihydroergotamine, the active ingredient in Trudhesa, and strong CYP3A4 inhibitors, such as protease inhibitors and macrolide antibiotics, have been reported rarely. As a result, these medications should not be taken together. Do not use Trudhesa if you have any disease affecting your heart, arteries, or blood circulation, are taking certain anti-HIV medications known as protease inhibitors, such as ritonavir or nelfinavir, are taking a macrolide antibiotic, such as clarithromycin or erythromycin, are taking certain antifungals, such as ketoconazole or itraconazole, have taken certain medications, such as triptans or ergot-type medications, for the treatment or prevention of migraine within the last 24 hours, have taken any medications that constrict your blood vessels or raise your blood pressure, have severe liver or kidney disease, are allergic to ergotamine or dihydroergotamine. Before taking Trudhesa, tell your doctor if you have high blood pressure, chest pain, shortness of breath, heart disease, or risk factors for heart disease, such as high blood pressure, high cholesterol, obesity, diabetes, smoking, strong family history of heart disease, or you are postmenopausal or male over 40, or problems with blood circulation in your arms, legs, fingers, or toes. You have or had any disease of the liver or kidney. You are taking any prescription or over-the-counter medications, including vitamins or herbal supplements. You are pregnant, planning to become pregnant, or are nursing or have ever stopped medication due to an allergy or bad reaction. This headache is different from your usual migraine attacks. The use of Trudhesa should not exceed dosing guidelines and should not be used on a daily basis. Serious cardiac, heart events, including some that have been fatal, have occurred following the use of dihydroergotamine mesylate, particularly with dihydroergotamine for injection, but are extremely rare. You may experience some nasal congestion or irritation, altered sense of taste, sore throat, nausea, vomiting, dizziness, and fatigue after using Trudhesa. Contact your doctor immediately if you experience numbness or tingling in your fingers and toes, severe tightness, pain, pressure, heaviness, or discomfort in your chest, muscle pain or cramps in your arms or legs, cold feeling or color changes in one or both legs or feet, sudden weakness, slurred speech, swelling, or itching. The risk information provided here is not comprehensive. To learn more, talk about Trudhesa with your healthcare provider or pharmacist. The FDA-approved product labeling can be found at www.trudhesa.com or 1-800-555-DRUG. You can also call 1-833-TRUDHESA, 1-833-878-3437 for additional information.